What should healthcare professionals implement to address socioeconomic and cultural barriers that contribute to the healthcare? You know, I gotta be honest, the angle in which I'm sitting makes it virtually impossible for me to see this. And so I could go old school and do like I did when I was a kid and sit with my legs squatted right here and read it, but I'm not gonna do that. I'm just gonna ask Joan to respond to that question that you all see on the screen. Joan Budden.
Thank you, Joe. It's an honor to be here today at this program and to be part of this esteemed panel. Healthcare is, I believe it's the fundamental part of society that makes, really, without your health, you can't accomplish any of these other topics we're talking about. And so the very first thing we need to do is keep people covered. As a society, it is absolutely essential that we at least continue with the programs we put in place. I can't think of a better place, besides education, to invest. And in terms of the health, it's something we should be honored to do as a society. Once we do that, using our data to do more predictive analytics, to not just understand the disparities in health, but begin to predict precursors and do interventions early so that we keep people healthy, not just look to treat them once they're sick. And I think that earlier on, prevention and wellness should be absolutely a critical part of any healthcare system that we develop. Of course, we're already trying to work on that as a society. Here in Grand Rapids, we have wonderful programs to do that. Medicine has made great strides to improve the quality of care. They've moved towards standardized care, evidence-based care, and that does make the outcomes better. But in every situation, people have different psychographic profiles, and healthcare needs to move along the way other industries have moved. So we know that, for example, in the African American community, there's a higher prevalence of diabetes. But that doesn't mean that one diabetes program is going to solve it for every African American. We need to look at what their belief systems are. Where do they trust or not trust the healthcare system? How can they get care? Where do they get care? Why do they get care? In order to help them prevent diabetes or to actually manage their chronic condition when they have it. So we need to look way beyond demographic information and begin to come up with more customized programs to meet the individual needs of different segments of societies. And that doesn't get painted with a broad stroke of a color of your skin or a zip code or any other classification that we put people into. It's customization based on your beliefs and your tenets. And then the third thing really, or the fourth thing really, is access to care. And that's such a broad term. But we know that, for example, people on Medicaid get 3 times more care in the emergency room setting than people who have commercial coverage. And why is that? They may have more urgent situations, but that's unlikely. It's the convenience. Emergency rooms are often on a bus or a transportation route where physicians' offices aren't. Physician offices are usually open during working hours. And if you're stitching together a couple of part-time jobs, your ability to get to a physician appointment when it is available for prevention and early intervention is really a difficult challenge. So I think we need to look at both the future and the past to solve this issue. The future, virtual visits. I think it was one of those entrepreneurial things that people developed that can have a true application to really impacting the care that people with transportation, mobility, or just scheduling challenges have. Probably all of us would be shocked at the depth of care that can be given virtually. Now, you can't fix a broken arm or stitch yourself up, but there are a lot of things you can do. So when there's a mom at home with 4 kids with 1 child with an ear infection, that can be treated virtually or diagnosed, and then the medication be given to a local location for the medicine, much better than trying to travel. It can be also used for rural areas where there literally isn't access to the providers that you may need. It can also be used for non-acute situations So chronic, like neuroscience, there are a lot of maintenance care that goes on that can be done through virtual care. So I think that virtual care can be one of the solutions to addressing disparities in health. The other is back to the future. It's going backwards in time. And that is literally meeting people where they are mentally and physically, literally, right? And so taking care out to the home. And we're seeing more and more of this done, right? In the Medicare population, we do it in our Medicare Advantage program. If you're you have multiple chronic conditions, you're frail, elderly, we bring primary care to you so that you can maintain your health. Same thing goes on in healthier communities and other places in our community that are looking to go out into the communities where people are and bring them the information, the need, and the care that they need to be healthy and to stay healthy. So I think there's all kinds of things we need to do. Healthcare is a very complex issue. It's starting with making sure that people have programs that they can access. It's continuing with a lot of the good ideas we have and using data to make sure that we're focusing on the right things.
Thank you, Joan.